Thank you. Just a brief introduction about myself. Like Lindsay said, my name is Lauren Clark. I'm a registered dietitian. I work at the Northeast Texas Cancer and Research Institute, specifically with Christus in the surgical oncology department. I've been a registered dietitian for a little over 16 years. Pretty much my entire career, I've worked there with Christus, even before we were Christus and back when we were just Trinity Mother Francis. I started my career there in the hospital working with the patients admitted. On the inpatient side, spent probably between 13 and 14 years working there in the hospital with patients of all different ages and disease states, all the way from the neonatal intensive care unit, the teeny tiniest of our sick patients, to the adult ICU. You should never say never, because I once said I never wanted to work with oncology patients. And then 2.5 years ago, the opportunity presented itself to move to an outpatient role over at the new cancer center. And I decided I was up for the challenge. And I've had zero regrets. I absolutely love working with the patients that we serve over there. Enjoy every minute of it. I am a wife. I've been married for almost 15 years, and we have 2 young kids. I have a son, Mason, who is 8. He's my baseball player. That's where I'll be headed after this, to the baseball fields. And then I also have a 4-year-old, Abby, who is 4 going on 14. She keeps us on our toes, but both of them keep us really busy away from our respective jobs. So it's a pleasure to be here today. What we're going to talk about is something that I'm pretty passionate about, whether you are a cancer survivor in the midst of a cancer journey or never had cancer. It is applicable to all of us. I'm not going to say anything today that you haven't heard before. There's not anything today that's going to be earth-shattering, groundbreaking, or mind-blowing. You've heard it all before, probably over and over again in some form or fashion. But it never hurts to get a refresher and to kind of deep dive and understand why these changes are recommended. What I will say is, when patients are referred to me there at the cancer center, a lot of the time they come to me and their biggest concern is, what am I supposed to eat as I go through the cancer journey? Or what am I supposed to eat now? Or what am I not supposed to eat now that I've had this diagnosis or I've completed my treatment and now I want to have a healthier lifestyle? And a lot of the time those patients are looking for a list of foods to eat and a list of foods to stay away from. And it's not that easy as much as patients would like for it to be. I can't just hand you a list of do's and don'ts. I can't just give you a meal plan. So really what I try to do is kind of educate on those foundational principles to set you up so that when you are making choices throughout the day of what to eat after meals and snacks, you can make informed choices to eat healthy, nutritious foods. So this handout that you all have in front of you, this colorful infographic, like Lindsay said, comes from the American Institute for Cancer Research. It is a fantastic resource. If you have never been to their website, I highly encourage you to check it out, aicr.org. There's lots of great information, a lot of specific diet information. If you have been through breast cancer, there's information tailored specifically to breast cancer patients. If you're interested in information on exercise, there's a lot of information tailored directly to physical activity recommendations. Being that you are all part of Courage, I would expect physical activity is important to you. That's why you're here today. So it's very important, and their resource is a really great one. So the first 2 things you'll notice on the top line of that page go hand in hand. 1 is to be at a healthy weight, and 2 is to be physically active. So I think we both can understand that those 2 things are closely integrated. Now, the one that says be a healthy weight, I tell people every day, take it with a grain of salt. What does be at a healthy weight mean? It's different for everybody. A lot of time when it comes to cancer and cancer treatment, you expect patients are going to lose weight and be on the side of malnutrition. But with some cancers and the treatment that goes along with cancer, specifically breast treatment, a lot of time causes the opposite, weight gain. And women typically come out heavier than they were to begin with, and that's very frustrating, and they have a hard time losing weight. And I coach those patients and I tell them, being at a healthy weight is not necessarily what your ideal body weight is intended to be for your height or what your BMI is supposed to be. BMI is nothing more than a height to weight ratio. And it's not always a great indicator of true health, okay? What I think is important when we're talking about being at a healthy weight is, how do you feel? Do you have energy? Do you have good energy level? Are you able to be active? Are you moving your body, and do you feel good after and while you're moving your body? And are you nourishing your body with foods that you know are good for you? If you can check those boxes, then you're at a healthy weight, is how I feel about it. So don't stress over the number on the scale. If it doesn't move in the direction that you want it to, I don't think that that is the end all be all for determining your healthy weight, okay? But physical activity is very important in helping us achieve that healthy weight. And what the American Institute for Cancer Research recommends is that you try to aim for 30 minutes of planned physical activity every day of the week, 7 days a week. Who can say they do that? I can't. 7 days a week?
No.
Walking? Yeah, okay. Okay, I do good to do probably 5 days a week, but it's hard. So some takeaways with that recommendation. 30 minutes doesn't have to be all at one time. Okay, 30 minutes can be broken up into 3 10-minute walks. If you have an animal that you want to get out and walk, I know if you have a high energy animal, it probably requires 2 or 3 times a day you're having to take that animal out to stretch their legs. So if you're getting out for 10 minutes, 3 times a day, there's your 30 minutes. And that should be fairly easy to do most days out of the week. With that activity, you want to look for a moderate intensity. What that means is you shouldn't be huffing and puffing, trying to catch your breath, sucking wind. Okay, it doesn't have to be that high intensity. Moderate intensity means you should still be able to carry on a conversation with somebody while you're doing that activity. But if you went to sing a song, it might be a little difficult because your heart rate is at least elevated to that point where you couldn't necessarily sing a tune, but you could still carry on a conversation. So that's what we're looking for with that moderate intensity. 7 days a week, 30 minutes a day.
Do you have a heart rate you work on for that?
I don't necessarily have like a heart rate that I recommend. I mean, if you have a heart rate monitor, there's usually like a middle zone. I know with the Apple Watch, there's like 3 different zones of that middle zone.
Back when I went to school, I took a couple of PE classes and they had like 220 minus your age, and it took a percentage of that is what you had to walk.
Yeah, I don't typically go that deep into it. I just like to tell patients, be able to talk, but singing might be a little too much. Okay. So physical activity. So the big green box, this is the one that I focus on with patients probably on a daily basis. What AICR recommends is that you try to eat what they refer to as a plant-based or a plant-forward diet. Don't let that intimidate you. They're not telling you that you need to be a vegetarian. That's not what that means at all. Okay. What they're recommending is that about 2/3 of what you eat each day come from plant-based foods. So if you think about all the foods we eat over the course of a day, they can pretty well be split into 2 categories. You have your animal-based foods, you have your plant-based foods. So your foods that come from animals, meat, dairy products, and eggs. Pretty much everything else is going to fall within that plant-based category. Your fruits and your veggies, your grains, beans, nuts, legumes, those are all plant-based sources, even down to like the seasonings and the spices and herbs we use to prepare the foods that we eat. They come from plants. So take a look at your plate the next time you sit down to eat and ask yourself, is 2/3 of what's on my plate plant-based? And if not, then you can see there's some room for improvement. You could certainly go 100% plant-based if you wanted to, but there is that 1/3 left for those animal-based foods if you prefer to. So the thing about plant-based foods, and the reason why they really push so heavily that we eat more and more of these foods, is they have in them special nutrients that we call phytonutrients. Phyto means plant. So those are nutrients that are specific to plants. You will not get those nutrients from your animal-based foods. Those phytonutrients offer some cancer protective benefits to them. They're much higher in fiber. And what we know about fiber is when we eat enough fiber in our diet, we reduce our risk for colorectal cancer. Our plant-based foods, they come in all the colors of the rainbow. you've got red strawberries, orange carrots, yellow peppers, your greens, your blueberries, the whole spectrum of the rainbow. Each color gives you different types of phytonutrients. So you really want to try and eat your rainbow every day. And I don't mean Skittles. You remember those commercials, taste the rainbow. That's not what I mean. I mean your fruits and your veggies.
I have a question.
Yes.
How do you properly clean those fresh fruits and fresh vegetables? Because I always hear, they're full of bacteria and you need to thoroughly wash them.
Mhm.
I've read several different things, soak them in vinegar, I don't know. So what's the best?
That's a good question. So there's a lot of misinformation out there. There's a lot of fear mongering out there about these types of things with pesticides and whatnot. As long as you're really just giving them a good thorough rinse underwater, for the most part, that's going to do all you need. For some people though, that need that peace of mind, vinegar is a great option. You can also purchase like fruit and veggie
I
cleansers.
saw that. Is that any different?
I don't know that there's any real evidence out there or literature to support that they're of any additional benefit.
Okay.
With some things like strawberries, there's the I think they call it the dirty dozen, like the list of the 12 foods that tend to have like the most amount of pesticides. You can put them in a bowl of water and submerge and just add in a teaspoon of baking soda and let it soak for 10 minutes or whatnot. Then rinse them off, and that helps to kind of leach out some of that pesticide the baking soda does. But as long as you're rinsing thoroughly, really that's good enough. Yeah, 10 minutes is long enough to soak.
Well,
with the
I
baking
heard
soda.
strawberries were hard or to clean because they have those little seed, little pits and. I love
Yeah,
strawberries.
strawberries is one they recommend the baking soda for. Raspberries, really the majority of like all your berries. Soak them in water, add the baking soda in, and then rinse them out.
How much baking soda?
Like a teaspoon. It doesn't take much.
It didn't take.
Okay, so now as we move into the next few boxes, the key word there is limit. So I'm gonna say that a few times, okay? The word is limit, not restrict. So it doesn't mean never. It means you can still have these things, but you want to limit how often and how much you're consuming them, okay? So that red box there, that next box says limit consumption of fast foods and other processed foods that are high in fat, starches, or sugars. So if you drive around Tyler, every corner, there's a fast food restaurant. And they're building Whataburgers like crazy, right? How many Whataburgers does one town need? I just can't get over why they keep popping up. Like, don't we have enough? So we really want to limit our intake of those drive-throughs, those fast foods. There's really not a whole lot nutritionally that they have to offer on their menu.
They're good, but they're not very economical.
That's true. Whataburger is sky high. Yeah. Even the dollar menu these days is a little is a little crazy, but so is the grocery store. So when we talk about processed foods, if you think about your grocery store, unfortunately in the United States, so much of what we eat is heavily processed. I truly believe our food system here is so backwards, the way we process our food and don't eat fresh food like we should. But if you think about your grocery store, if this is your grocery store, when you walk in, that outer perimeter of your store is where you're going to find the fresh whole food. Okay. The middle of the store, the aisles, when you're weaving between all the aisles, that's where you're going to find the processed stuff, the stuff that's in the packages, in the cans, in the boxes, in the bags that have been processed. What we do through our processing is we typically take something that starts out pretty good for us, and then we strip the good away, and we add in fat and we add in sugar so that it tastes really good. And we put it in a package so it's really convenient and we can eat it on the run. It doesn't take a whole lot of time to prepare. We call that food. But unfortunately, all that added fat, all that added sugar in our diet contributes to weight gain. And what we know, why number one on there says be a healthy weight, is that by being overweight or being obese can increase your risk for 13 different types of cancer. So if you can really do more of your shopping around the perimeter of your store, where you're focusing on getting those fresh whole foods, that's how you can really eliminate a lot of that processed junk, if you will, from the diet. So a good example of this that I like to review with patients, let's take rice, for example. If you purchase white rice used to be brown rice. And when it was brown rice, it was a whole grain. And that whole grain had some fiber in it. It had a little protein with it. It had some good B vitamins and some other minerals with it as well. But when we process it and we strip that whole grain away, all that nutrition goes with it. And what you're left with as the white rice is just a starchy filler that doesn't really have a lot of nutritional value other than it's a carb. That's a good example. Pasta as well. You can buy just your white enriched processed pasta, but now you can also buy whole wheat pasta, where now you get that whole grain. Personally, when it comes to the spaghetti sauce that you're gonna serve with that pasta, like I told you, I got 2 kids that keep me busy. I don't have time to make spaghetti sauce from scratch for spaghetti night. So I certainly do reach for that jar of ragu or prego or whatever's on sale at the store for the week, right? But where I try to make up for it is buying the whole wheat pasta. So I'm not getting the overly processed pasta. Sometimes I'll even, let's go plant-based, buy like the zucchini little zoodles that have been spiraled and do that. And even do a mixture of some of the zucchini and some of the whole wheat pasta, so you get a little bit of both. So I hear less complaining from the children that they're getting zucchini with their meal is a good alternative as well. So, any questions about processed foods?
I have a question about, I know that canned stuff is full of sodium and various stuff like that, but, what about, because a lot of times fresh food for just me and my husband goes back into it and eat it. What about frozen food? Where does that fall in the, like frozen vegetables? Where does that fall
Frozen's
in?
nearly as good as your fresh.
Okay,
Yes, the only time I would be a little cautious is if there is like little frozen pellets of a sauce in with it, you know, that would melt down to be saucy. You might get the added sodium or some extra fat there. And really and truly, with even with canned, while yes, with a canned vegetable, there's likely going to be more added salt. If eating canned is what gets you to eat your vegetables, eat them out of a can. It doesn't matter to me, okay? You can actually rinse them off under tap water and it'll get rid of a lot of that added sodium. Some is still gonna leach into the vegetable, but if you rinse them off, you can do away with quite a bit of that. And now if you just spend the time and look on the shelf, you'll find no added salt options available. So there are better options out there, but when it comes to vegetables, if canned is all that you have time for, if canned is all you can afford, if canned is all that you like, if that's what gets you to eat your vegetables, eat them out of a can. Okay. Okay. The next one is, again, limits your consumption of red meat and processed meat. So red meat is, of course, we're in Texas, beef, but also pork is a red meat. Not everybody realizes that, thanks to the advertising in the 90s, that pork is the other white meat. Pork is actually a red meat. But also veal or lamb. Those are your big 4 for red meat. So what AICR recommends for red meat specifically is that you try to limit your intake to no more than 12 to 18 ounces a week. Okay, so if you follow standard portions, like 3 to 4 ounces at a time, you know, that still leaves you room for 4 or 5 servings a week of your red meats. Okay, the thing about red meat, it's hard because we live in Texas and we like our beef, is that they found that excessive consumption can actually increase risk for colorectal cancer. So that's what the link is there. It's the colorectal
What
cancer.
about this?
Venison? That's a good question. I don't think venison is technically considered a red meat. I think it's actually kind of like in between.
Well, they're an active animal,
Yes.
and that makes a difference.
Mhm. Yeah, they're much more lean. You definitely don't get as much saturated fat from it. Now, processed meat, thinking about processed meat, that's like your luncheon meats, but also bacon, sausage, hot dogs, all the charcuterie board, all the meat you find on a charcuterie board, which is real trendy right now, that's all processed meat. What AICR recommends there is that you eat as little as possible. They don't even give you a concrete number of servings to aim for in a week. So to me, a nutrition professional, I hear eat as little as possible. To me, that just shouts that it must be really, really bad for us and to really try and stay away from it as much as possible. So save your hot dogs for the 4th of July.
Turkey bacon.
It's still processed.
Oh, yeah, I
Yeah.
guess it is.
There is no good breakfast meat. So get your protein from your eggs or from plant-based sources. I know. I know. It's a hard pill to swallow every time I get to that one. Because we like our processed meats. I mean, even the luncheon meats, you want to make a sandwich at home for a quick lunch or a quick meal, those luncheon meats are considered processed. There is, I think it's the Hormel brand now is making one that says it's nitrate and nitrite free. So that is a much safer and better option.
So that's what you look for, non-nitrate.
Yeah.
Interesting.
Yeah.
What about the Jewish
The Nathan's hot dog.
wieners and things like that?
You know, I don't know the answer to that. I think they're still processed to some
There's
degree.
some process, but they eliminate a lot of.
They
stuff.
do, yeah. Yeah, so definitely if you can find one that is labeled nitrate or nitrite free, that's a better option for you. Okay, the next box, this one hits hard for a lot of people. Limit your consumption of sugar sweetened drinks. So I think everybody has a bottle of water in front of them now, though. That makes my heart happy.
That's all we were offered.
That's true. That's true. There's a reason for that. Sodas, the regular sodas, sweet tea. You know, we now have a Starbucks on every corner next to the Whataburger. All the fancy coffees you can get at these fancy coffee shops, they're packed full of sugar. Even like the energy drinks and a lot of the canned drinks that you can find now, they're sweetened with sugar. And again, just like with the processed food, all that added sugar contributes to weight gain. Do you have a question?
Fruit juices?
Fruit juice, so that's more sugar naturally because the fruit has sugar in it naturally, but fruit juices do a lot of the time have added sugar. So if again, spend some time on the juice aisle, you can find the ones that are no added sugar as a better option.
What about when you go to the coffee shop and you say that you want a skinny one, which is sugar-free, but they put in a sugar-free syrup or something? What about that?
Yeah, so the sugar-free is a better option than the actual sugar itself. Now, are sugar substitutes good for us? No. But I personally feel like they're the lesser of two evils, okay? And the studies that they're doing on these sugar substitutes to show that they cause cancer or that they have all of these negative outcomes, the amount that we would have to consume to see those outcomes, nobody could ever consume in a day. So a little bit of sugar substitute to sweeten something here and there is perfectly safe. Again, there's a lot of fear mongering out there on the internet, especially on social media about those sugar substitutes. Better than the actual sugar itself. I think they recommend with added sugars that we try to limit to no more than like 6 to 10 teaspoons a day, which is like 100 calories just coming from added sugars. Start looking at food labels because food labels have to tell you the added sugars now and count the calories that you're taking in just from the added sugars. And you'll see quickly how fast you get to 100 calories from added sugars. We put sugar in everything. It's just the American way, unfortunately. And the thing is, because we put sugar in everything, our taste buds are accustomed to that. So then when we eat something that doesn't have it, doesn't taste good to us. But your taste buds adapt to what you expose them to. So if you can avoid it long enough to get over the hump, you won't miss it as much. And you'll get to where foods taste good in their natural form without all of that added junk. A long time ago, early under my career, I covered the heart hospital, the Lewis and Peaches Owens Heart Hospital. I saw all the cardiac patients. And they all got put on low sodium diets. And every patient, when I would walk in, they would grumble about the meals they were being served because there's no salt, there's no seasoning, this doesn't taste good, it's bland. It's the same thing with salt. So much of our food has a lot of added sodium in it. we're used to that. It tastes good to us because it's what we're accustomed to. If you start backing off and cutting that sodium out of your diet, over time, you'll adjust to it. And then you'll go to eat a potato chip and you'll think, wow, this is way too salty. This doesn't taste good to me anymore. Your taste buds adapt depending on what you're exposing them to.
I used to drink sugar in my coffee
Uh-huh.
till in the teacher's lounge one day, that a teacher picked up my cup and drank it, and she didn't drink sugar, and she spit it back in there. Well, that broke me from drinking sugar.
Okay, limit your alcohol consumption. So with limiting alcohol consumption, when we talk about moderate intake, for a man, that is no more than 2 drinks a day. For a woman, it's only 1 drink per day. When I say drink, it's an ounce if it's hard liquor, it's 5 ounces if it's wine, it's 12 ounces if it's beer. And when I say 1 per day or 2 per day, you can't save them all up for Friday night. It doesn't work like that. I'm sorry to report. Yeah.
One drink, negative.
Yeah, I know. Why is that? Why do we get one and they get 2?
I don't know. I don't know who makes these rules.
Exactly.
Yeah, yeah.
One of those things in my.
Okay. So the next box, the green box, it says do not use supplements for cancer prevention. There are a lot of herbal dietary supplements on the market that will claim that they can prevent cancer, reduce your risk for cancer, things like turmeric, curcumin, different things like that. The truth is that there is just not enough evidence to support that they are truly of any benefit when it comes to cancer risk. So AICR just says, just not even use them, stay away from them. Now, they may offer some other health benefits, right? That's not usually the only thing on the label that they're claiming is of benefit to you. So, certainly if you want to look into using them for some of the other benefits they may provide, that's certainly up to you. But from a strictly oncology standpoint, there's just not evidence to support that they're of benefit. Okay. On the bottom row, it says for mothers, breastfeed your baby if you can. So if you had the opportunity to breastfeed, I hope that you did. It does help reduce risk for breast cancer for not only the mother, but also for the infant. So lots of benefits from breastfeeding. And the last box there, the yellow one, says after a cancer diagnosis, follow our recommendations if you can. So if they're saying anytime you've had any diagnosis of cancer, to try to follow as many of those recommendations as possible. In the fine print at the bottom of that page, there are 2 other recommendations. They are not related to diet, but I always like to touch on them because they are things that you have control over to help reduce your risk. One is to stay away from nicotine and tobacco products. And the other is to make sure you put on SPF sunscreen when you're going to be out in the sun for that skin cancer risk. Questions, comments, concerns?
We got some questions up here from the Zoom
Okay.
group, so I'll go with this. So somebody asked, what about hydration, like IV or like sugar powders, stevia sugar powders you put in the water?
Like liquid IV. Yeah, so liquid IV has a sugar-free option that utilizes the sugar substitutes. A lot of some of those electrolyte replacement beverages and powders that you can mix in the water do have a lot of added sugar. So if you can find a sugar-free option, it's better.
Jacob wants to know about diet sodas. Are they better for you compared to regular sodas?
Yeah, so like I was saying before, with the sugar substitutes, I think they're the lesser of the 2 evils. You don't take in the empty calories from the sugar when you drink a diet. Now, should you be drinking a diet soda with every meal, and should that be all that you're sipping on throughout the day? No, again, they should be consumed in moderation. What we should be drinking throughout the day is water. It's what's best to hydrate us. Sodas, especially if they're caffeinated, caffeine actually has a diuretic effect and it can work to dehydrate you. It works against your efforts to hydrate yourself. So you don't want to count anything you're drinking with caffeine in it towards your total fluid intake for the day.
So how much influence should you have of water a day?
As a general rule, you want to aim for about 64 ounces. So 8 ounce servings a day. of those uncaffeinated fluids.
Someone asked, any suggestions when water gets boring?
Yes, so there are lots of flavor enhancers that you can buy now, the little drops you can squirt in or packets you can mix in. Again, usually they're the sugar substitutes that give them their nice flavors. But you can also find all kinds of ideas online for doing like fruit infused water, where you can just like cut up some strawberries, put them in the bottom of the pitcher, let that sit in the refrigerator. And it does give a nice essence, while it's usually pretty mild, but it does give your water a little bit of flavor. Lemon, lime, you can do cucumber, which is kind of refreshing in the summer. There's lots of different recipes and ideas for that if you just go looking for them.
So, the no good breakfast meat hurt my soul. Just wanted to know that. So I wanted to ask about red meat. So, do you know of any studies on red meat that have looked at it independent from like body composition, or looked at it in conjunction with body composition?
Not that I've read myself.
Okay, well, you said, regarding a diet rich in whole grains, vegetables, that's a plant-based.
Plant-based, yes, ma'am.
Okay, so what is the not plant-based? It's meat, dairy, and what was the third one?
Eggs. Those are your animal foods. If it comes from an animal, it's not plant-based.
Okay, that's my whole diet right there.
It's the rice that's killing them.
The rice, we can do like brown rice. Remember, that word was limit. It was limit. So it might take you 5 years to get through that bag of rice, but doesn't mean you have to throw it out.
We had a patient ask about hint water.
What is it?
Hint water. So they're just like real mildly flavored. They have a hint of flavor in them. So that's the name of the brand is
I
Hint.
thought you said him.
And I've not looked at the label myself to know what it is that is the sweetener, or if there's calories in them. If they're calorie free, it's sugar substitute. I've not looked at them closely myself, but they are definitely a better alternative to a soda.
So those sparkling waters that just have a hint of something, there's all different, okay, so just look and see if sugar is added somewhere.
Yeah, most of the time it's the sugar stuff.
Well, what about all these drinks that are, straight from you or something like that, and they just are everywhere. I don't drink them. but I
No,
just-
there are a lot of claims, but they're not gonna.
A lot of
do a whole
caffeine and
lot,
stuff,
yeah.
you think, in them?
Well, I learned a few.
What about some alkaline water?
About, what was it?
Alkaline.
Alkaline.
Is there an water to drink?
You know, our head and neck surgeon actually really pushes the alkaline water in his head and neck cancer patients that deal with the reflux, because it does help neutralize, well, not, I shouldn't say neutralize, but at least lessen the acidity of their stomach so that they're not getting as much of the reflux. So that's something that you suffer from. It
So
could
what's
be
the
better.
brand?
Alkaline water?
That's it.
There's
I don't
a place
know.
in the French Quarter that sells it.
Yeah, pretty much anywhere you look at a case of, bottled water that's
Okay.
refrigerated, you'll find a bottle, it'll say alkaline in big letters.
But when I researched that a little bit, it was like, you don't drink it with your meal, is what it said, and it said you have to drink it before you eat or wait 2 hours after you eat. It was kind of restrictive, and I didn't really understand it. We bought a big thing, and then my husband keeps saying, it's still sitting there, you need to drink it, but I'm always eating.
Well,
Yeah.
it may be that if it does affect the acidity level of your stomach, it may be that if it interferes with digestion, that may be why they have the restriction.
I mean, truly, I don't think it is alkaline enough that it's gonna keep you from being able to digest your food, because stomach acid is so acidic. But if you do suffer from reflux, it might be good to switch to that just to help lessen some of that.
Well, what do they? So you're a dietitian in the cancer. Is there a dietitian in the heart unit? I'm not a cancer survivor. I'm triple bypass surgery.
Okay, so yes, in the hospital, there are still multiple dietitians that take care of the patients while they are admitted. On an outpatient basis, there is not a dietitian employed by Christus that is specific to cardiac. However, there is a group of outpatient dietitians that work with the endocrinology office that do general medical nutrition therapy. So patients with other chronic conditions would be referred there.
We have a question. Someone asked about what good meats are there to eat for breakfast?
What good meats are there to eat for breakfast? Well, if you're thinking of your, traditional breakfast meats,
Lots.
bacon, sausage, ham,
But what about
not
salmon?
much.
Smoke, you can't do smoked salmon though.
Well, it's gonna be more processed, yeah. You could do it's red meat, so you'd have to count that in your servings for the week, but you could do like a steak omelet, you could do some steak in the morning.
What about cheese?
Cheese. Well, it's an animal-based food, so you would want to include that in your third for the day, but dairy products are a really good source of protein. So if you're looking for the replacement meat for the protein, dairy would be an option.
Good choice for calcium,
Good for calcium, yes.
because I have an omelet every morning.
Mm-hmm.
And some spinach.
Yeah, Greek yogurt, cottage cheese would also be good alternatives.
Somebody asked about, a couple of questions. One, what potential damage could have been done to the stomach or digestive system as a result of, say, breast cancer treatment? And then, the follow-up was, could you recommend a good probiotic?
So the first question related to the breast cancer treatment, I don't know the answer to that question. I'm unsure. I think it would depend, like how recent was your treatment, if you're still dealing with side effects from the treatment. And in terms of probiotic, the thing about probiotics are they come in a lot of different strains, and each strain has different benefits to it. So it really depends on what you're looking for in terms of the outcome from the probiotic, what would be a good option for you. A lot of just the generic ones that you buy over the counter are like lactobacillus, which is good for digestion, but you can buy them that are tailored specifically for women that are going to offer some other benefits that would be just specific to women. You can eat yogurt, which has live active cultures in it in place to help get some of those good pre and probiotics
What was that
in the gut.
lacto thing you said? Lacto what?
Bacillus,
Spell it.
BACILUS.
Okay.
Any other questions? Anything else for? No? I think that was all for our questions on Zoom. Oh, what about sparkling mineral water like Pellegrino?
I don't think that has any added sugar or sugar substitutes for that matter, so that would be a great option.
It's just a club, so.
Yeah.
Okay, well, if that is all the questions that we have for Lauren, we're gonna go ahead and wrap it up today. So thank you all for coming. Thank you on Zoom, and thank you, Lauren, for dedicating your time. Awesome. Well, that is all, and we will see you guys next month at our next workshop. Y'all have a great day. Thank you.